Today, 1 in 4 American adults are living with a diagnosable mental illness. In California, we know that 3 out of 4 of those adults aren't having their needs met. Fear of judgment, discrimination, and isolation prevents many from asking for help. Deeply ingrained beliefs and negative attitudes about mental illness are called stigma. In 1999, the U.S. Surgeon General said that stigma is the most formidable obstacle to improving mental health. Recent research shows California young people and adults alike display high levels of stigmatizing beliefs and attitudes. Myths and misconceptions about mental illness are widespread. Most adults are unsure whether treatment is possible, and many are unaware that discrimination is an issue for those living with mental illness. Even those who consider themselves open and accepting say they'd hesitate to work closely or socialize with someone diagnosed with schizophrenia. Many adults wrongly believe individuals with mental illness are likely to be violent. And then stigma also extends beyond the individual. It becomes institutionalized in policies and ingrained in society. For example, negative portrayals of mental illness far outweigh the positive in the media we consume, from news stories to TV shows and movies. Institutional, societal, and individual forms of stigma feed one another, and their intersections present the opportunities for change. California is pioneering effective stigma reduction strategies based on research that shows misinformed and negative attitudes can be changed. First, when approaches are targeted, population-specific, and culturally relevant. Second, when an audience can make a connection to people who are living with mental illness. Third, when strategies focus on prevention and early intervention. Fourth, when stakeholders are involved with planning and implementation. Fifth, when partners such as law enforcement and education are engaged. And when programs are aligned at the local, regional, and statewide levels. Nationwide, untreated mental illness takes a personal, societal, and budgetary toll. More days of work are lost because of untreated mental illness than because of diabetes, asthma, and arthritis combined. In a historic effort to reduce personal and societal cost of untreated mental illness, California voters approved Proposition 63, the Mental Health Services Act, in 2004. The initiative provides the funding and a framework to transform California's mental health system to focus on prevention and wellness while expanding services to underserved populations and California's diverse communities. Prevention and early intervention strategies are at the heart of this transformation, coordinated by the California Mental Health Services Authority, or CalMESA. Since 2004, hundreds of thousands of Californians have helped build an effective community-based mental health system from the ground up. Through a community needs assessment, more than 100,000 people across the state helped plan for the new community-based mental health services. In the outreach and engagement phase, partners from all sectors, education, criminal justice, healthcare, and mental health consumers provided insight into the needs and strategies. Counties expanded effective programs and developed new community-based approaches, and then each of the 58 counties launched mental health services focused on recovery and wellness. Prevention and early intervention programs and services are now underway throughout the state and offer the best long-term approach to reducing costs and saving lives by delivering help to people in need before they reach the crisis point. The California Mental Health Services Authority, CalMESA, is funded by counties to administer prevention and early intervention strategies focused on stigma and discrimination reduction, suicide prevention, and student mental health. Rigorous ongoing evaluation and assessment of the new programs allow us to document progress and identify the most promising practices to be expanded and duplicated. Each program funded by CalMESA undergoes a rigorous independent evaluation conducted by the RAND Corporation. RAND's evaluation is assessing the power of stigma reduction strategies to turn negative stigma cycles between institutions, society, and individuals into a positive circle of acceptance. New laws and policies can shift social norms and individual actions, and vice versa. In the same way, media portrayals of mental illness that defy stereotypes have the power to break down individual prejudice as well as institutional approaches to mental health issues. It'll take time to realize and record the ultimate outcomes of California's historic effort to reduce stigma and discrimination, but the dialogue about mental illness in our state is already shifting. More and more Californians are refusing to stay silent while untreated mental illness takes an unnecessary toll on our families and our communities. This new conversation emphasizes not only recovery, but also the outcomes beyond it, prevention and essential well-being. Now, after over a decade, we are giving a name to the momentum that is carrying this conversation forward. The future of stigma and discrimination reduction is Each Mind Matters, California's mental health movement. We invite you to join us at eachmindmatters.org.